So we're getting there. We have another great discussion here today, another talk on data platforms. So we'll get into that now. So joining us is going to be Maureen Kelly. She's the director with Data Stewardship Initiative for the Canadian Institute for Health and Information. And she's going to be talking on the Pan-Canadian Health Data Stewardship, so driving Canada's health system data forward.
All right,
Thank you, Maureen.
Okay, thanks so much. All right. So thanks, and I'm really pleased to be able to share some of the work that we're doing around data stewardship and how it's helping drive the transformation we need in our health data ecosystem. So I'm going to quickly talk a little bit about CIHI and what we do in case people don't know who we are. Sometimes I think we're Canada's best kept secret. Talk a little bit about Canada's health data ecosystem, some of the complexities that make some of the challenges of having data to use for decision making, and why we have some of those challenges, and talk about the work that I'm leading around health data stewardship for the country. So in terms of CIHI, or the Canadian Institute for Health Information, we're an independent not-for-profit organization, and we were founded in 1993 by the provinces, territories, and the federal government to provide and drive forward improvements in the health information for the country. So we provide essential information on Canada's health system and the health of Canadians. So we provide information to publicly available, we make it available back to the health system, and we also provide it to researchers for them to be able to do research that can also drive improvements to the health system. So we actually have a big report coming out tomorrow about some key indicators that are taking the pulse of healthcare in Canada and the recent investments the provinces and the federal government have made. So if you see any data reports from around healthcare tomorrow, that's our data. So why is health data so important? And really, we're trying to think in this day and age about health data being critical national data infrastructure. And it matters for a whole bunch of reasons. And I'm actually going to start at the right-hand side. Obviously, we need to have good information to provide excellent care to our patients and improve our health system, and that's kind of a key imperative. We also need our health systems to be sustainable, and we need information to understand how that information information on how our health systems are performing, so that we can manage costs and drive improvements to make healthcare better for our patients. We know in this day and age, we have to think about the sovereignty of our health data. Our health system is very reliant on particularly US technology. A lot of the hospitals are using American-based vendors. We're using American-based cloud systems. So we have to think in this day and age about how we protect our data and keep it and try and think about how we can be less dependent on some of those and manage some of the risks that we are now seeing with our data. And last but not least, we can think about our health data as an economic asset. Healthcare is responsible for at least 12% of our GDP, according to our national expenditures data that comes out of our shop. And that is a key part of the economy. We employ a large proportion of people in the health workforce. And a lot of our information drives and can continue to drive research and innovation in the health and life sciences sector. So, which again will drive forward improvements in our health system and care in the future. So who needs all our health data? And Obviously, we are always thinking about the users of health data when we're thinking about what types of tools and resources and information that we need to give them. So first and foremost, our patients and families and the public need information. We're all patients of our healthcare system, and it's very hard for us to get access to our own data. So hands up who's ever gone in and actually tried to access some of their health information through a patient portal or something like that. Okay, not very many of us. And how many have had to do that in different portals, particularly in Ontario? We have in what Ontario stakeholders sometimes call portalitis. So where we have so many different platforms where it's really hard to get a really good understanding of what's going on with your health when it's in lots of different fragmented systems. So we need to put patients in the driving seat of their own healthcare, and that means access to your own health records. The healthcare providers, too, need access to that information. We have clinicians who work with us, and they tell stories about how they have potentially killed people because they didn't have access to that health information. That is soul-destroying for them, but also it is really hard on the families of those people, knowing that they could have had different care and different outcomes if the clinicians actually had access to the right information at the right time. Public health, we've all still living with the after effects of the pandemic, and during that time it became very, very clear that we struggled to get the information we needed to manage the health emergency that we had. And even on a regular day, you hear in the news about the measles outbreaks and the need for immunization information to be able to help manage some of these public health crises and keep us safe and make sure that we have, the public health professionals have information to really help improve and protect our overarching health. Our health system leaders and everybody in the health system, whether that's an individual or health delivery organization or the ministries and lots of other stakeholders who provide support to the health system, they need that information to manage the health system and, as I mentioned, drive improvements in the healthcare system that they are responsible for. And as I said, last but not least, research and innovators want that data to be able to drive and make new discoveries and help improve care and new products and therapies so that we can actually drive improvements in our healthcare. So all of those different people are actually looking for different types of data, looking for different types of tools and support, but we all need the base data to come from the health system. But the health system, as we all probably know in this room, isn't actually one health system. We talk about it sometimes as a health system, but it's actually multiple systems. We have each provinces and territory is responsible for their own healthcare. We do have federally based health services, veterans. We talked about the military. They have their own healthcare system. We now have the Canadian Dental Health Plan that is administered by Health Canada. And we also have an increasing number of independent Indigenous health services, all trying to work together to provide healthcare to individuals. And we don't have just a publicly funded system. So as this shows, about 70% of the money that's spent on healthcare does come through publicly funded sources from Health Canada through the federal health transfer, but also the provinces and territories themselves. But 30% comes from private funds, so a lot of that comes through insurance benefits, employee-based benefits, and also self-paid care. And on top of that, we also have publicly funded providers, but also lots of patient private providers. So our healthcare system was probably the first public-private partnership because almost every single physician is their own independent business who receive public funds to provide healthcare to us. So with that really sets up the challenge that we have, which is we have all of these systems and organizations that have their own data, they have their own rules and tools and priorities, and that results in lots of data silos with complex and inconsistent rules to be able to get access and share that information, and it really limits the data and sharing that we have. So that data fragmentation means that we have lower productivity, it's slower to make those innovations that we all want to make, and it means that the health system has increased costs. And that all results in poorer outcomes and quality care for all of the Canadians, including, which means us. And when we look at those challenges, and there's lots of investment in technology in healthcare, but when we look at some of these challenges, while there are technology challenges that do need to be fixed, a lot of the underlying issues are actually not technical at all. They're related to organization, behaviors, governance, and actually human factors as well. And those are some of the things that I'm going to be talking about. So, like many other public sector things, we know that we're dealing with a lot of legacy systems and information systems in healthcare, and we are trying to collectively transform health data for Canada, and CIHI is helping lead that charge. So we are trying to switch from lots of individual systems into this kind of one whole data ecosystem mindset and thinking about how we can work together collectively, because we know from past experience that we're not going to be able to do it. Any organization is not going to be able to fix these problems on their own. We have to work together as a more coherent network to actually fix the problems. We know that we need to improve the data quality and timeliness of the data, and we're working on initiatives to really focus our efforts on trying to make sure that the data is available when it's needed and that it's at the quality that we have. We know, particularly in primary care, there's a lot of different EMR systems out there with varying levels of information quality, and we need to be able to make sure that the right information is getting to the right people at the right time. We are trying to optimize technology and workflows and leveraging AI where we can. So we have a lot of bespoke systems, we have a lot of manual processes, so trying to work from the ground up and trying to look at how we can optimize those and use newer technology and web-based technologies, AI, to really help support and reduce the burden and the cost of all of the data that is coming into the health system. And really, as we try and leverage AI both within CIHI and to support others as they're using AI in the health system, really trying to make sure that we get those benefits and return on investments where it's really needed to help reduce administrative burden for clinicians and to get the more insight out of the data. So as I mentioned, we're doing a whole bunch of different things at CIHI. We're actually taking a really important look at how we can leverage generative AI and help develop Canadian models that can be used, sovereign models that can be used for others to leverage for AI development. We have one of the most diverse populations in the world, and that comes with lots of potential benefits for developing new AI models, and hopefully that we can benefit from those models. And based on the systems and needs that we have in Canada, we have a very diverse population in terms of rural, remote. We need to make sure that we have those lenses through our populations to really meet the needs of what we need. We're taking a look, you saw today some of the data already that's been used. So the Ontario Ministry was using our data from our emergency departments for some of their very cool analysis, by the way. I thought it was very cool. We're trying to reinvent our hospital data systems. They were built for an analog world when we still had paper and pencils. And we really need to kind of improve the efficiency, both not just from a CIHI perspective, but for the hospitals in terms of getting that data in as fast and as efficiently as we can. We're also improving our data on our health workforce. Again, during the pandemic, it became very clear that we have some good insights into some key parts of the health workforce, but not as much or at the depth that we need going forward to really help plan the policymakers plan our health workforce strategies and deal with the challenges we have with an increasing population and reducing the burden that we have, and also the existing demand that we already have for healthcare services. And we also have a roadmap of improving our pharmaceuticals data. We have a lot of great information about publicly funded pharmaceutical prescriptions, but that's not all of the drug information that we have. So we're trying to develop all drugs for all people and fill in those gaps, both in terms of private claims, hospital drugs, and cancer drugs and drugs for rare diseases. We're trying to make sure, and I think if you were in the information from the CAMH yesterday, they talked a bit about the challenges about sharing data across health systems and health organizations. So we're supporting that work with improving the data standards with which we're using, that can be used in the health system, so we have more consistent information that can be shared across health systems, and that the healthcare clinicians can trust and understand and make their decisions based on that information. And last but not least, and I'm going to spend the rest of my time talking about the information that we need to really change the way we think about the way we share information, and do so that we can share the information responsibly and equitably to really make improvements to the healthcare system. So when we think about our health data, if you think about our road network, where we have roads in each province and territory, and we can connect up them, we have rules of the road in terms of how we drive. We all drive on the right-hand side of the road. We have very similar speed limit signs. We have lots of different things that make sure that we can drive and get to our destinations safely. But if you think about our health information as a road network, we have no rules, or we have different rules for different types of data. It's not very clear what those rules are. We have no signposts. We have no information around how we can get to those destinations safely. So when we think about all of the things that we have in place as drivers, we have those rules that have been set by the provinces and territories about the speed limits, the signposting. We have licenses around that we have to pass a test to be able to have to be allowed on the roads. And for certain types of vehicles, we have to do extra tests and know extra things to be a truck driver or drive a taxi. Our vehicles themselves have to be licensed and meet certain standards. And then we also have maps, and at this day and age, they're all in apps to be able to help us navigate where we go. We need these types of things and consistently, and to be able to fit together. So right now we can drive from Newfoundland to Victoria across our roads and a few ferries. But we wouldn't be able to do that we can't take our health data with us. So we're thinking about, from a stewardship perspective, what do we need to make that a reality? So first and foremost, we need this collaboration and structured governance for us to all work together. We all have good intentions, but we're all doing things slightly differently, and there's lots of great work happening across all of the different health systems, but we need to be able to leverage that in a much more efficient way to actually maximize the use of our data. We have a publicly available framework, which I'll show you in a minute, in terms of articulating what we actually need to improve to make this a reality, and to be able to provide guidance and tools and resources for all of the people who are involved in data to be actually work together and make this happen. So one of the key things CIHI's been doing over the last year has been building momentum and talking to a lot of our stakeholders. So we have done, this is a very busy site and I'm not going to go through the details, but we've talked to a lot of stakeholders, the ministries at the provinces and territories. We've talked to different health organizations. We've done international scans and talked to kind of key people in Europe and in the UK and elsewhere. We've started our relationship building with First Nations, Inuit, and Métis organizations. We've done lots of presentations and talking to people about what we're trying to do. And we actually, at the beginning of the summer, held a great forum with 75 different organizations coming together to really build momentum and get like-minded people to drive this forward. We've also put together a strategy to talk to patients and really trying to put them at the core of decision-making and sharing and having them involved in making decisions about what happens with their healthcare data. So part of the work that we've done so far is invited the patient partners to be part of that forum I just talked about. We also held some focus groups to talk to understand what good data stewardship would look to them, and how we can use that information to refine our framework and really make sure that we had good insights into what was key issues for them. So what we heard was that really needed to reframe and everything to make sure it was patient-focused. We're very technical sometimes, so we really need to make sure that the language that we used was accessible, and really kind of reinforce the need, as I talk about the governance framework, to really make sure that they're involved in the decision-making. So I'll spend a couple of minutes just talking about our stewardship framework. And first, as I'm talking to data people, in terms of our definition of what data stewardship is, it's a little different than, and we've got a strategic aspect as well as operational aspects to stewardship. So oftentimes we think about stewardship in that operational sense of just like having somebody responsible for the data and understanding and making decisions on a day-to-day basis about the quality and who can have access to that data. But for some of the things that we're trying to do, and this is kind of how they talked about it in the Pan-Canadian Health Data Strategy report that came out after the pandemic, we kind of also need to take a strategic view of stewardship and actually try and change the conditions with which the environment with which we're trying to share data. So that includes, and we talked, there's been lots of conversations to this over the last 2 days about the importance of culture and the principles we're using to set the foundation for all of the work that we're trying to do. There are challenges with our privacy legislation. We have a myriad of different legislations that, depending on if you're a private entity, a public entity, which jurisdiction you're in, the rules are very different, can be quite different. And so sharing across those legislative frameworks is challenging. So we need to look at how we can align those more closely. But we also know that there is a lot of data that could be shared within our existing legislation and regulatory frameworks. There isn't, and that is some of these other challenges that we know that we need to face. There are challenges with organizational risk tolerance, and that we need to address. We also need to think about data strategies and making sure that everyone's aligned on what's the most important things that we need to tackle. And in the middle, we have data governance, and we see the governance both from a strategic lens in terms of making sure through our Pan-Canadian governance model that we can make sure we're setting the right priorities for the whole country's health data ecosystem, but also that we can support all of the operational work that is going to happen, and what some of those day-to-day rules of the road are going to be. We've talked a lot today as well and heard lots about data literacy and particularly around data stewardship literacy. There's a whole bunch of information that we know as data practitioners around the day-to-day management of data, that we know there's a lot of legacy systems out there without the right metadata. Some don't have good data quality information. So what are the things that we can put in place to really help support some of that day-to-day management of the data? And at the very right-hand side, looking at the use of the data and what are the things that we can really support to make sure that we have good use and responsible use of the data and that the data is not misrepresented. And across the bottom, we have two key things. I've already talked a little bit about the need for public trust and engagement throughout the whole process of what we need to make sure that we have a good and responsible data ecosystem. But last and definitely not least is our need to contribute to reconciliation with our First Nations, Inuit, and Métis populations, and how we can support their data governance and their sovereignty over their own data. We have a lot of Indigenous data within our health data ecosystem. And how can we open that up and make sure that those communities and organizations have access and can use it to have sovereignty over their own data and make decisions about their own health and their own healthcare systems and their own priorities. So I've touched on many of these things, but as I said, as we talk to the patient, our patients and all of our other stakeholders, one of the things they said is like, well, what does good data stewardship look like? And tell us, and we need to know that. What are we aiming for? So through the conversations we had, we put this together in terms of the key aspects of what we want to be able to see as we're moving forward. So obviously the key one is making the data available to those who need it. But we also need to make sure that we're still safeguarding it, because it's very sensitive information, that we're safeguarding it against misuse, both from a security perspective, but also a quality and misinterpretation or even disinformation, that it's not being used against the populations that it's designed to support. We also need to make sure that we do adhere to our laws and ethics, but that we're also advancing those and where we need to change them, and really making sure that we are transparent in what we're doing, and that transparency will help build trust. So in the last few minutes, I'm just going to talk a little bit about our governance model. I'm going to skip this slide just for time. So we're trying to work at this pan-Canadian level, trying to get all of our provinces and territories and all of the different organizations working together. We're actually looking at, and we're putting this into place, where we're going to have a kind of collaborative table that's made up of not just the provinces and territories, but other key stakeholders, to come together to decide on and advance a action plan. We're also going to have an advisory panel, and through the conversations we've had, rather than have kind of an expert advisory panel and a patient advisory panel, we're going to bring those people together and make sure that we have a diversity of people that can come together and give us direction and advice to that collaborative table, and really speak truth to power, essentially, as we move forward. And we're going to have working groups to move forward and work on the actual details. So my last couple of slides, this is some of the key things that we're doing now that we've got all of those foundations in place. As I mentioned, we're trying to set a joint stewardship agenda to really make sure that we're moving the right things forward. Working on solving key stewardship problems, so starting with some key use cases with our jurisdictional partners to drive, to put this stewardship plan into action, and really trying to create those reusable tools and playbooks for people to make it easier for them to do the right thing. So we recently got presented this, our CEO presented to the Conference of Deputy Ministers of Health in September. So we got endorsement at the highest level to continue to move forward. So we'll be publishing the framework in November. And we're working on standing up the governance structure, and as I mentioned, continuing to work on those use cases, including trying to support the use of AI in healthcare. And look forward to continued engagements, particularly with patients, First Nations, Inuit, and Métis people. So this is our mission, to get better data to make better decisions and healthy Canadians. So thank you, and I think I'm over time, so I will stop there. So thanks very much.